You can feel completely fine while your heart is already working harder than it should. And most people have no idea when this phase even begins, because long before symptoms appear, the heart often goes through a quiet period where it's simply adapting to the increased workload. In this video, we'll walk through 3 key principles that explain how stress affects the heart. First, we'll talk about what actually increases the heart's workload. Second, we'll discuss how the heart adapts to all this extra pressure and stress over time. And third, we'll review why many of these changes can develop for years before anyone even feels the symptoms. Because understanding the sequence helps explain why heart disease can sometimes feel sudden, even though it usually develops gradually. So let's go ahead and get started with the first one: what actually increases the workload on the heart. Now, here's the fun fact that most people don't realize. If you took every blood vessel in your body, so this is your arteries, your veins, and those tiny capillaries, and laid them end to end, they would stretch for about 60,000 miles. That's enough to circle the earth more than twice. And the heart beats about 80 to 100,000 times a day. And with each beat, it pushes blood through thousands of miles of vessels. So when cardiologists talk about the heart being under stress, what we're really talking about is the physical workload of pushing blood through this incredibly large and complex vascular system. Because when resistance anywhere in that system increases, even if it's slight, the heart has to generate more pressure to keep moving that blood forward. And over time, it's that extra workload that begins to start changing the heart. One way to picture this is like driving a car on a flat road versus if you're going uphill. On flat ground, the engine runs smoothly, but as the road gradually becomes steeper, the engine has to work harder to keep moving forward. It's also important to talk about the kinds of things that can slowly increase the demand on the heart over time. Some of these increase pressure in the system, and high blood pressure is the most obvious example because it directly increases the resistance the heart has to pump against. Others place a metabolic demand, things like increased abdominal fat, insulin resistance, change how the body uses energy, and that can increase the workload placed on the heart as well. And then there are conditions that repeatedly activate the cardiovascular system, even when it's supposed to be resting. So this would be things like untreated sleep apnea, or chronic sleep deprivation, and persistent sympathetic activation, all of which can cause repeated surges in blood pressure and heart rate. And individually, none of these usually cause symptoms right away, but over time, they increase the pressure, the resistance, and the metabolic demand that gets placed on the heart. So what is the heart to do when it's exposed to that kind of stress over years or even decades? It adapts. And that brings us to the second principle, how the heart changes when it has to work harder for long periods of time. The heart is actually very good at compensating for increased demand. It's not that different from what happens when you lift heavier weights at the gym. As the workload increases, the muscle responds by getting thicker. It's a process called hypertrophy. Similarly, when that main pumping chamber of the heart, called the left ventricle, has to keep pushing against higher pressure over time, that part of the heart muscle gradually becomes thicker. And in cardiology, we call this left ventricular hypertrophy, or LVH for short. But unlike skeletal muscle, thicker heart muscle tends to become stiffer. And over time, this stiffening can affect how the heart muscle relaxes and fills between beats. The reason this is important is because the heart doesn't just need to pump blood out. That's one of its jobs, but it also needs to relax properly so that it can fill with enough blood for the next beat. And long-term studies like the Framingham Heart Study have shown that increases in left ventricular mass are associated with higher risk of heart failure, arrhythmias, and even stroke. And blood pressure levels that many people consider borderline, so systolic numbers in the 130s, have also been associated with higher long-term cardiovascular risk. In the clinical setting, these patients with high blood pressure, whenever they undergo imaging of the heart, many already show evidence of this thickening of the heart muscle. Now, pressure overload is just one way in which the heart remodels and changes. There are different types of stresses that affect the heart in different ways. For example, untreated sleep apnea can lead to changes in the lung pressure as well as place strain on the right side of the heart. Then you have metabolic conditions like obesity and insulin resistance that can lead to increased fat around the heart, which is metabolically active. Other things are chronic sympathetic activation from persistent stress or even sleep deprivation that can repeatedly raise heart rate and blood pressure. And excess alcohol intake directly weakens the heart muscle and leads to enlargement of the heart chambers. So as you can see, the heart doesn't respond to stress in just one way. It can become thicker, it can become stiffer, or it can even sometimes become enlarged depending on the type of stress it's exposed to. And all these structural changes are what we call cardiac remodeling. It's part of the heart's attempt to maintain normal circulation in the face of increased extensive demand. In fact, many of the conditions we see later in cardiology, so think things like atrial fibrillation or heart failure, are often preceded by years of subtle structural changes in the heart, which is why it's important to understand that these structural changes can develop gradually over a number of years before someone even presents with any concerning symptoms. And that brings us to the third principle: why you don't feel these changes as they're happening. And the answer is that one of the most fascinating things about our heart is how much reserve capacity it has. It's almost as if the heart was built with a large margin of safety, because at rest, your body is only using a portion of the heart's full pumping ability. Now, on top of that, the body also has several systems that help maintain normal circulation even when the heart is under increased stress. At the arterial level, blood vessels can tighten or relax to help maintain blood pressure and preserve blood flow to vital organs. Then you have the nervous system that also responds pretty quickly. So it can increase heart rate as well as contractility, allowing the heart to pump more forcefully whenever the body needs it. Finally, there's the hormonal systems that can help regulate blood pressure as well as manage fluid and vascular tone, keeping that circulation stable even when the heart is working harder. So together, these compensatory mechanisms allow the cardiovascular system to continue functioning normally, even while increased demands are being placed on the heart. And that's why many of these structural changes that we discussed earlier can develop for many years and even decades. But compensation has limits, and if the demands stay for long enough, there eventually comes a point where these adaptive changes are just no longer able to maintain the normal function. And it's at that tipping point when symptoms begin to appear. So the takeaway is this: the absence of symptoms doesn't mean that there's absence of changes. Because the heart rarely fails suddenly, it usually adapts quietly first.